You can't have MAHA without these different aspects of care.
I think it's foundational. It's the largest network of primary care in the country.
I'm excited for kind of the momentum that you guys are having in the policy space. I think you have a huge opportunity with MAHA. I think you have a huge opportunity with this rural health transformation program. And I think that you're starting to get more champions. And so I'm most excited to see your champions grow.
Health centers are serving almost 34 million patients at this point. As you know, 90% of them are at or below 200% of poverty. Welcome to Community Health Centers Unfiltered, the podcast where we explore the policies, programs, and people shaping the future of community healthcare. Today, I'm pleased to welcome Gabrielle Kalisz Minarik, Healthcare Policy Program Manager at Paragon Health Institute, here in the studio to talk about the future of healthcare, the MAHA framework, and the vital role community health centers play in our healthcare system. We'll dive into how MAHA could change the way care is delivered and financed, why primary care and preventive care are so critical, and how health centers are uniquely positioned to lead the way in innovation and patient-centered care. Whether you're a healthcare professional, a policymaker, or a patient, this conversation is packed with insights about what the future of healthcare could and should look like. I'm Amanda Pierce-Kelly, and I am so excited to welcome our guest today, but also all of you who are going to join us for this very important conversation. Here we go. Hey everyone, I'm Amanda Pierce-Kelly. I'm the CEO of Advocacy for Community Health, and this is Community Health Centers Unfiltered. I'm really excited for the conversation and to be with our guest today, Gabrielle Kalisz Minarik with Paragon Health Institute. She has a wealth of experience. She's someone that we've been able to connect with before at the ACH annual member meeting earlier this year, and she is just, there's a lot of wisdom and there's such good conversation. So I want to start by giving her an opportunity to introduce herself, and then we're going to dive into this awesome conversation. So Elle, you want to introduce yourself?
Hi, well, yeah, thank you for having me here today. Like you said, I am Elle Kalisz Minarik. I'm the program manager over at Paragon Health Institute. Paragon is a nonpartisan research healthcare only focused think tank. We are really focused on reforming government and empowering patients. So that looks like a lot of different things, anywhere from medical innovation and finding cost savings, but also really taking a look behind the hood and saying, what matters for health, what is really impacting our health. So we do that in traditional and non-traditional ways. We have 4 main initiatives, which are going to be private health, public health, Medicare, and Medicaid. And then on top of that, we are launching a couple of others. So we're launching a state health reform initiative this fall. We also are getting into kind of artificial intelligence and AI and what that can do for our healthcare system, and then also kind of taking a look at life sciences. So I think across the board, Paragon tries to have really pragmatic policy solutions that are not just focused on cost savings, but are also focused at putting the patient at the center of healthcare. I think for far too long, we've thought about healthcare as a large system of all these bibs and bobs and all of these different entities. And sometimes we can lose sight of what we're really trying to do, and that is make people healthy, make them have empowerment over their healthcare, make them excited about their healthcare and want to have control. And so that really is what Paragon's focused on. I'm the program manager, which is really just a fancy term for utility knife. I mainly serve as the cog between our policy and research department and then our communications department. So a lot of that looks like taking our awesome research papers and boiling them down into really how to sell it and how to get home, not just to the policymakers that we are hoping that are going to engage in this reform, but the people at home that want to feel more empowered in their health, that they want to know what to talk about and where to get engaged in, which is really exciting. I love getting to be a part of pretty much every aspect of Paragon and all the good work that we're doing. We're young. We were launched almost 4 years ago, but not even quite then. But we've really hit the ground running, and I think we've made a reputation for ourselves about having clear, pragmatic solutions that no matter what side of the aisle you're on, you can either learn something and nod along and agree with us, or disagree and become even more, central in what you believe. And that's entirely why Paragon exists and what we're here to talk about today.
Yeah, I love that. And you've already said a bunch of things that make me excited for even the next conversation, especially with the upcoming initiatives that you're bringing in terms of state policy and then AI, which are both very front and center for us right now for a variety of reasons, which we're going to get into. But I also really love the fact that you have and you really were clear about the importance of people. And I think whether it's healthcare or honestly anytime you're talking about policy, I think people can get lost in that. And so I appreciate you sort of bringing that front and center. And I think especially as it relates to the health center mission, like that is us. That is what we're trying to do. So alrighty, there's alignment, of course, and I appreciate that. I also it's helpful to sort of hear you describe like a little bit of the history of Paragon, because I think you guys have really made a name for yourself and had huge impact and influence, but I don't, not everybody knows kind of who you are, what you're doing, all of that. I didn't realize that you guys were just 4 years in. We are too. ACH is about 4.5 at this point, which is wild. Sometimes I'm like, oh my gosh, it feels like it's been a lot longer than that.
It feels like that too. I've been at Paragon for 2 years. We were founded by Brian Blase, who was on the National Economics Council under Trump 1.0, and a bunch of friends that he kind of met along the way. And I think that Brian, to his credit, saw that there was a need in not only just the think tank and the policy reform space, but just the space kind of overall for folks that looked at, okay, what works in the private sector, in the free market, and how can we bring that into where we're at now with government programs. We talk about the patient perspective. That's why I got into healthcare. So I've been at Paragon for 2 years now, but my main motivation was getting into healthcare was that my sophomore year of college, I went through some pretty intense medical episodes and ended up being a patient myself. So I'm from a rural area, I'm from a small border town between Chicago and Milwaukee. My parents are both teachers, which meant that I was on an HMO insurance plan. So I went to American University here in DC. And so, when I was diagnosed with quite a few things, I had to petition my insurance company to be able to cover my care for me in DC because HMO is regionally based. Yep. And so kind of after all of those experiences in hospital stays and treatments and working with my doctors, I had all of this experience on how to petition my insurance company and how to read medical bills, how to read insurance. Like, I'm a healthcare policy expert myself, but once a year I'm always like, I don't know what any of this is. What does this mean? And so I think that took, my love for politics and international policy and really married it with something actionable. And I think that's why I found a home at Paragon. I was a lobbyist before. I did a couple of other things in the healthcare space, but I found a home at Paragon because we're so reform focused. And I get to lead with being a patient. My own patient experience, my hospital stays, et cetera, are with me and part of what makes me me. And that makes me good at what I do at Paragon because the patient perspective is first. It's not just focused on having cost savings so that the federal government can continue to provide care. We also need to empower patients to understand what that care is, know the different lines of service that they can go to. Not everything needs to be doctor or hospital based. And that's something we really strive to be a core center of our mission at Paragon. And so I think that's what's made us so good at our jobs. I think people talk about that all the time. There's not that many of us. There's less than 10 of us that work there full time. But I think what makes us good is we're not just doing things the traditional way where you do a bunch of academic research and then you put the paper out into the ether and that's where it stays. And so we have conversations like this and we go to the Hill and we go to the White House and all of these other places and really try and have pragmatic conversations about don't just do this reform right now because it saves money or you think it's the good thing to do, but think about the unintended consequences of policymaking. But I think that's how we got the jumbled mess that we have as a healthcare system right now.
Yeah. Well, and again, I think like pulling out there's already, a lot of areas where there's overlap. I think one of the really special, unique components of health centers is their consumer majority board. I mean, that literally doesn't exist, as you know, in any other part of the healthcare system. But by having that majority consumer board, which is bound by law, it guarantees that the patients are actually the ones helping to design and respond to the needs of the community versus, someone who is well-intentioned but distant, whether it's in DC or some other part of the country. So I love, again, hearing that. And there are a million questions that I want to get into. So I think, right now we're in a really interesting time, certainly of change and transformation and what the future of healthcare looks like, especially in practical terms. So I would love for you to speak to sort of what do you think that vision looks like? What are we working toward from your perspective and sort of where Paragon sits?
Yeah, I think that we were just talking about really well-intentioned policy. I think majority of things in healthcare, regardless of what side of the aisle you're on, we just saw a ton of Medicaid changes come through in the reconciliation bill from 2025. The passage of the Affordable Care Act, which was over 10 years ago now. All of these things are made with the intention of having it work out well, both in cost savings and the experience for the patient. But the reality is that I think our healthcare system is really entrenched with what we refer to as corporate welfare, that we tend to subsidize. I think we're really coverage focused. You hear, monikers like Medicare for all of these things, and everyone is always focused on getting people covered. And I think that we try to peel behind and say, okay, what comes after that coverage? And so for us, that looks like patient-centric healthcare that is also portable. So we talk about health savings accounts a lot. And so, we've done a lot to subsidize insurance companies, to subsidize hospitals, to subsidize all of these large entities, and we haven't exactly gotten healthier for it. And I think that's why you've seen a lot of people start to really attach themselves to the Make America Healthy Again movement, because they see this all the time. Healthcare is expensive. Hospital prices, all of these things continue to skyrocket while other aspects of our economy continue to go down. Like the cost of a flat screen TV when I was a kid was like exorbitant. And now that I'm an adult, they're really affordable. And so I don't think that that's a coincidence that the industries, healthcare especially, that we over subsidize end up leading to higher costs. And so Paragon really takes a look at, in terms of what is the future of our healthcare system, how can we put the patient in the driver's seat? And how can we put the people that really work with patients and work in communities and working with meeting patients where they're at right next to them? How can we deregulate or even pass other legislation that really empowers the patient? So whether that be health savings accounts, whether that be federally qualified health centers, all of these other things, it's important that you start to get the patient involved. And so we make the case that maybe instead of subsidizing industries, we should give all of those subsidies back to the patient for them to decide what to do. So we have a policy that we call the HSA option. It was actually the first research paper that Paragon commissioned and did, at the start of the launch of our organization. And the whole idea of that is, instead of getting a subsidy to make your health insurance more affordable in terms of what you're paying every month, because your premium doesn't always mean that your health insurance is going to be affordable. You're talking really high out-of-pocket costs, et cetera. So maybe instead of taking a subsidy that goes directly to these insurance companies, you could give a subsidy to the patient to then have in their HSA to then go out and be able to make decisions. And I think that that's where, there's opportunity for health centers and all these other things. But the aspect of, if you could take your health savings account and you could go see an integrative medicine service. So maybe you don't like pharmaceuticals and you don't like over-medicalization. You can go and find something that's more nutrition-based, that's more focused on all of these other aspects of ourselves. And if you have a health savings account, you're able to take pre-tax money and go out and use it. And so I think that's what the future of the healthcare system looks for us, is really having the patient in the driver's seat. And instead of, engaging in so much corporate welfare where all of this large billions, trillions of dollars in federal money are going to these corporate entities, can we give them to the patient and to the people that are meeting patients where they're at?
So I love what you just said in terms of meeting patients where they're at. I think that is literally the health center story. That is where and how we exist. I have so many questions that I want to dive into, but before I kind of bring us back, I want to get into Make America Healthy Again.
Yeah.
And I think that, well, actually two pieces. So I think part of what I'm hearing, and I want to speak for you, but I think part of what I'm hearing is the need to also maybe shift to primary and preventive care. It's sort of like, what are we doing to keep people healthy and to manage their health so that they're not having more complex issues? I think the other thing that you mentioned was that there's medical and clinical care, but there's also a lot of other things that surround that have to do with whole person health. And so I'd love to hear you speak to a couple of those things, sort of that whole person health lens, but also just what you're thinking in terms of investment in primary and preventive care specifically, because I think, again, right now, the percentage of the dollar spent, if you look at, cumulative for healthcare, it's such a small amount that's going to primary and preventive care. That's challenging for us, obviously, for obvious reasons on the health center side, but I think also just would love to hear your lens on that, just system-wide, and what you guys are thinking.
Yeah, absolutely. Primary and preventative care is very important. There will be different healthcare scoring experts that say, preventative care saves dollars long term, and that's true. That's also what we need to be focused on. But the reality is that primary and preventative care cannot continue to do well or even continue to grow kind of our terms of how much overall spending we're spending in the healthcare system until patients want it. And so I think that when we talk about the Make America Healthy Again movement, I do think it's some of this reckoning post-COVID, where you had a lot of centralized corporate entities and centralized government entities that made a lot of decisions for a lot of folks. And I think in the beginning, there was a lot of trust there that, they're doing what's right, they're doing this to protect us so we can get through this pandemic. And I think, unfortunately, that trust was lost. And so when we talk about primary and preventative care, it's not just about, cost savings in terms of later down the pipeline, preventing them from getting to the catastrophic phase of needing surgeries, finding diabetes before it turns into full-fledged diabetes, understanding that there's a lot of the reasons why in the American diet that most of us are pre-diabetic and we don't even know about it. But it's also this aspect of making sure that we are positioned in really increasing trust so that patients also seek out that type of care. And I think that we've lost that. And so you're starting to see this reckoning of, like you said, all of these different other aspects of health, whether that be nutrition, et cetera. And so I think that when we think about primary and preventative care, it's also looking at alternative models. So something that Paragon is really, really excited about post the One Big Beautiful Bill, or, the reconciliation bill in 2025, is that there are expanded HSA offerings, and part of that is for the first time you can use your HSA on direct primary care, which is concierge models where you pay in a monthly fee and then you go and you have a trusted primary care professional that is looking at all different aspects of your health, and all of that is kind of included in that concierge fee. And so you really saw something that's really empowering for patients on the primary care front get married with something that's giving patients more control over their healthcare dollars. Yeah. And so the more options that we have in finding those partnerships where you can empower the patient to also want to go out and seek out these alternative aspects of care, it's really important. And I think it's something I talked with you guys about in March. When we're looking at chronic diseases, and that's really the root of the Make America Healthy Again movement, the fact that, we're more over-medicalized than ever. Arguably, healthcare access has never been at a larger peak. There's so many different modalities that you can go through. But we're seeing just like this large prevalence of chronic disease, and it continued to get worse. When we take a look at that kind of under the hood and we talk about children, almost 50% of the nation's children with chronic disease are on Medicaid, yet federally qualified health centers and health centers overall are 2% of Medicaid spending. And we know that these entities are better at doing this care. They meet patients where they are. They have a more, overall complete whole care metric, a sphere of care that's really looking at everything from the bottom. And health centers have a lot of things that they're not reimbursed for, services that they provide just simply because they know that they're going to improve health. And that's really important. So I think that as we have these conversations about primary and preventative care, that we also take a look at our spending and really ask ourselves, where is the majority of the spending going? And how can we kind of change the tap on that? How can we unleash more money going to different aspects? So I think, like I said, health savings account and DPCs are awesome. I think what partnerships can we have with federal qualified health centers, et cetera. But primary care at its root is really about working with a patient to empower them in their health, to make sure that they are going to the doctor once a year, that they're receiving all of these services, and that they're not afraid to go out and get care. And I think right now we do have a large issue where we don't have enough trust, and folks don't feel like going to the doctor is good. And so unfortunately, we have people ending up in emergency rooms.
Yeah.
And I don't even think that they're just ending up in the emergency room because they're not taking care of themselves and all of a sudden they're in this catastrophic phase of their care. But I don't think people don't realize that you can go to a health center. The direct primary care exists. So I think part of preventative and primary care in terms of making it more important is also patient education.
Yep.
And we're so focused right now on everything that you see on TV ads, et cetera, that is hospitals, insurance companies, pharmaceuticals, and not all of these other options that you have. And so I think that we're focused too on how can we make patient education better so that they know what's out there for them.
Well, I love that. I think there's, again, every time you respond, there's like 5 things that I want to dive into. I mean, but one of the things that I really appreciate that you call out is that health centers, we have primary and preventive care, but it is all of the surrounding services. I do think, health centers are serving almost 34 million patients at this point. As you know, 90% of them are at or below 200% of poverty. And so I think for the existing patient population, there are realities and challenges just in terms of access, but also just resources, and even education around something like a health savings account where, does there need to be training and support around like how do you do that and how do you manage? But I think what I appreciate and where I want to take us a little bit is in the Make America Healthy space in particular, because it's obviously a key focus of your work and many others in the administration and on the Hill. It's also really a focus for health centers, partly because it does resonate in terms of so much of the work that they've been doing in the legacy of the program literally for 60 years, whether it be chronic disease management, nutrition, whole person care. So I'd love to hear about just kind of breaking down like, one, how do you view the approach that MAHA is proposing differently than sort of what's been at stake or how it's been deployed, but then also the role of health centers and sort of where do you see them fitting into that?
Well, I will say just off the bat that I don't think that you can have a Make America Healthy Again movement without health centers. I think that we're still figuring out, what that pathway forward is. And I think, there's a lot of conservatives and folks that I work with too that can be skeptical in terms of routing certain money or creating discretionary fundings that are supposed to be temporary that just like continue to get knocked down the road. And so I think it's a matter of finding ways to integrate in systems that we already have. Paragon does this under the Make America Healthy Again guys, but also something under what we call our American Wellbeing Initiative. And so we did a paper last summer that really took a look at insurance, and it said what mattered for health and the role of insurance in that. And what we found was insurance coverage has very, very little impact on your overall health. Yet so much of our conversation is so focused on insurance coverage and this idea that insurance coverage means access. I think health centers are proving that wrong. I mean, you guys have a large uncompensated care pool, a large pool of folks that do not have insurance, whether that be that they exist in coverage gaps or they're not offered it at work and they still don't find these other options to really be affordable for them. And so I think obviously, again, that's patient education and showing, you can come out to us, we can do all of this, but really trying to change that conversation away from so coverage focused, because when we are so coverage focused, we're not talking about the little guys that are down there at the end of the stream. We end up talking about hospitals and insurance companies and pharmaceutical companies and all of these things. And so, in Paragon's work, and something that I've seen too, is, not all health centers are made the same. I think we talk about this in rural health a lot, about how when you see one rural community, you've only ever seen one rural community. They're not monoliths, and that's the same thing for health centers. There's also different types of health centers. Like I found out this year, actually, after the panel I did for you guys about certified behavioral health centers, and how they're really at the forefront of addiction care, and how what they're doing, meeting patients where they're at, being able to have all of these different aspects of things that aren't necessarily reimbursable, but really, really important to folks that are struggling with addiction, and just looking at the data and seeing how awesome it is coming out of there. Texas, Idaho, et cetera, they all have data that's showing that these specialized health centers are really making a difference in addiction care. And so it's swapping that model on its head. We don't need to always be focused about coverage. We need to be focused about, who is providing that care. And I think MAHA does that well, because it gets at like a central truth. I think the reality is we really have degraded the doctor-patient relationship. And I think that a lot of that is through different incentives. And so I think that there is distrust on the patient side that a doctor that they would go and see is, always acting in their best interest. I think especially after the opioid crisis, some of these other things, I think they view doctors as, okay, well, I don't necessarily want a medication. Like, what else can I do? And that's where health centers are poised to have the best answers, yet we're continuing to kind of route care away from them. And so I think that as we get more into MAHA and as we look at that way for health centers, is that you can't have MAHA without these different aspects of care.
Well, I appreciate you saying that. I think I agree. You can't have MAHA without health centers. I think it's foundational. It's the largest network of primary care in the country. But I also think, and to your point, like I totally understand what you're saying about, shifting the conversation to constantly being about coverage, which I will admit, it is really important to us. And that has to do with the reality for our patient base. Basically what we know is if you're lacking resources or your, income is scarce and whatever your situation is, if you don't have coverage, there's fear of, oh gosh, can I actually access care? And to your point, we care for everyone regardless of their ability to pay when they come through our doors. But I also think the reality for health centers is financial solvency. It's sort of the investment in health centers to address and to be able to support the uncompensated care for uninsured or the gaps that exist is real, and most of them are operating on a 1% to 2% margin. And so in HR1 with the recent passage, there's concern because there's just there's no wiggle room. It's sort of, if you pull one lever, the stability and the solvency of the organization can be really impacted. And so I think a program like Medicaid, which I think everyone would say we're all for wise reforms, but much like the 340B program, quite frankly, it has to be done in a way that protects health centers and creates the resources and supports the resources to be able to care for people where they are. So I'd love to get into that a little bit, where it's sort of like, okay, if clearly there's transformation and there's change happening with the Medicaid program, and I think across healthcare in general, but health centers are really struggling, and I think our funding right now in this very moment is very uncertain. So do you have thoughts on that and sort of what the continued investment might look like?
Yeah, I think that, there are concerns from a lot of folks about this. I think, I take a little bit of a different approach when it comes to understanding coverage concerns. I think in general, rural areas, et cetera, we're really needing to get into the conversation about right sizing and what services are appropriate. And I think for too long in our healthcare system, we've took a one size fits all approach. And a lot of that is like through subsidization, et cetera. You brought up 340B. There's also the disproportionate share hospital program. DISH, but MACPAC itself, every year they do an overview of DISH and says, what's happening? Is this improving the amount of people that are uninsured? Is this improving the uncompensated care pool? And year after year, they say that as a commission, that they do not find a connection between the DISH allotments and improving the uncompensated care pool or improving the number of people that are uninsured. And so I think that is a large glaring red flag that the way that we are subsidizing, the way that we are making investments is improper. So I think that there are some concerns to be had about, the reconciliation bill and what that means for health centers. I also think that for far too long, hospital systems, especially large hospital systems in urban areas, there's an example of when in the reconciliation process, there was a think tank that came out with a list of rural hospitals that were going to be at immediate risk of closure, right? So I looked at that list and I was like, I need to make sure, what's going on. Can I use this to inform some of our advocacy throughout this effort? And I found that there's one health system who has a combined total net positive revenue that is higher than Disney, Amazon, and ExxonMobil, and 17 of their hospitals were listed at immediate risk of closure. And I think that gets to my overall point here is that large systems, and the ones that we are heavily subsidizing, are being taken away from resources that should be given to health centers, rural areas that are indigent and truly struggling, and instead are getting rerouted to these large systems. G. Bai, who's a Paragon public advisor, she just came out with an article in JAMA that talked about there are over 420 nonprofit healthcare hospital systems, or hospitals in general, that have a dual classification as urban and rural, which means that 421 entities are taking away resources that are meant for these truly rural folks. And so I see a large opportunity here with the Rural Health Transformation Program. It was really important to me in any conversation that I had with a policymaker, or really anyone, that we made the case that health centers needed to be able to get a piece of that pie. And so I think, my concerns with the reconciliation bill are also that this $50 billion investment, which, half of it is going to be equally doled out to the states. So I think that means that each state gets roughly $800 million. The other half is going to be at CMS's discretion. And, CMS also, to their credit, I think more than people are willing to give them, came out with a list of weighted factors that they're going to use to kind of consider, where this money should go. And one of the weighted factors they have is, how many federally qualified health centers do you have? Are they integrated in your state plans? Do you have state processes that are working with these individuals? Other aspects of that are short-term limited duration insurance, which can be really helpful to folks that did just lose coverage and might be on the verge of getting more hours at work to where they will get ESI or will be able to afford more private coverage. You have to unleash that. You have to unleash alternate aspects of care. Another thing that they have as a weighted factor is certificate of need laws. And I don't think that people also understand how that impacts health centers, and how in some states you have large HOP boards, or certificate of need boards, that also have board members who have skin in the game in terms of for-profit health systems or for-profit hospitals that are also directing and arbitrarily deciding if an additional federally qualified health center or a CCBHC is needed, or if another hospital or substance abuse center is needed. And so CMS says, if you have these laws, we're not going to give you as much money because it's not going to be as effective. And so I'm hopeful with the Rural Health Transformation Program that, there will be a surge in funding for health centers and for CCBHCs. And I'm hoping that the states listen to you. And I think that that's something that I came and talked to you guys about in March, that there is not a need for more entities to do the bidding of hospital systems, but instead to go to policymakers and say, right now we are 2% of Medicaid spend, but look at all of these outcomes that we're having, look at what we are achieving, look at all this care that we are able to provide at such a small margin, which means that you guys are good financial stewards. It means that you're looking for cost containment. It means that you're looking for patient satisfaction, that you're looking at all of these, additives and good signs that come out of putting the patient first. And so we need to have more conversations with policymakers at both the federal and state level about, let's get these guys integrated. Let's start talking about them. And, to your credit, like you said, you have a small amount of resources. And so that's something that I said really outright, which is, if you have a small amount of resources, do not get interested or wrapped into doing the bidding of other people that truly don't care about if that money trickles down to you, because that's how we got where we're at right now. Instead, use your limited amount of resources to go in and talk about what makes you different, what makes you better at being able to provide that care. And I do think that that's changing. I think there's a lot of hope for health centers right now. And so it might be scary, with coverage loss or all these things, which, in my personal opinion, could be somewhat overblown in terms of what's actually going to happen. But using that as a way to go in and say, I need targeted investment. I need to be part of your rural health transformation funds. And not just because we're making a difference right now, but because when we talk about, this being a temporary 5-year program and things becoming permanent, health centers have to be at the center of that. They can help right-size care. They can help take a small amount of resources and stretch them across across really thinly, but in an effective way. And you can also say, okay, beyond the next 5 years, if you give us these more resources, this is what we can do, and we can make it stick. We can make these impacts be permanent. And so those are the types of conversations that we need to be having. I think it's very easy to get fearful and to shudder in the face of fear. And I think that take that under your wing and take that as a reason of, now more than ever, you need to listen to us, because if these resources do get gobbled up by these large for-profit entities or these nonprofit entities that didn't earn their nonprofit status and instead really just have it in name only, that's going to continue to harm you guys. And we know that with the data, et cetera, that you guys are pushing the envelope in both of terms of care outcomes and how to use resources. And so those are the conversations that we need to be having.
So I just want to take you on the road with me to have that conversation. But so 2 questions for you as follow-up to that. One, do you think, and are you hearing kind of reinforcement or understanding of that, particularly on the Hill in this moment, because funding is so important, about the need for targeted funding for health centers? Like, is that understood on the Hill and, you know, cross administration agency? But then the other piece would be, you know, we do have limited resources. And, you know, full disclosure, like, I think every health center and every community is different. And we do have hospital partners that are really important. Yeah. They're doing really great work, particularly in rural areas where the partnership between the two are really important. That is not to say that, to your point, there are, you know, scenarios and bad apples and all kinds of, you know, opportunity for improvement. But one of the things I love that you said is that, yes, there's a lot of fear and there's change right now, but there's opportunity. And I think the opportunity for transformation that literally puts health centers at the center is really, we're in that moment. But I think to your point about, okay, so we're looking 5 years out, what would a targeted fund look like? Have you guys been having any conversations? I know ACH actually quite a while ago put forward what we call CHC Invest, which creates a roadmap for, look, this is what we can do, to your point, with greater investment. Here's not just what we can do, but also the return that we can produce on that. But I'm curious, like, do you have thoughts specifically about what a targeted investment with health centers would look like? And then do you hear that? Is that resonating with administration, with policymakers?
So I will say overall that I think that health centers are more popular than ever. I think, you know, Senator Marshall has used the term health centers for all, you know, trying to talk about this. I think, you know, Senator Cassidy, et cetera. I know Brian Fitzpatrick in the House is really excited about this, specifically CCPHCs. And so I think that you are winning more champions by the day. And I think that in order to win more champions, you have to just continue what you keep doing, like being data forward, showing that this is our, you know, additive advantage. I think Paragon right now has not really thought about, you know, beyond these funds that you got in the reconciliation bill, what that looks like. I think it's a conversation worth to be had. Like I said, I think that there are reasons for conservatives to be skeptical in terms of what that looks like, because I think oftentimes, you know, we talk about targeted funding and then the next thing you hear someone say is a slush fund. And admittedly, that is the first thing that popped into my head when I heard about this $50 billion rural health transformation program. And then I looked beyond the hood a little bit more, and I had conversations with my community health center partners that I got as a result of you guys. And I said, you know, what can I do to help you guys at the state level, like have some of these conversations, right? And I think that that's where you have kind of this divergence, as we talked about before, about being a monolith. I think small independent rural hospitals that make less than $42 million a year, which is like the CMS definition, they're also only 2% of overall hospital spend. And so they are very different, and they are existing in a very different space than an urban academic medical center is. Right? We also have workforce issues and recruiting, and I know that that's an issue that health centers have all of the time, is how can you convince a resident to want to come here where you're going to have all of these issues and you're going to have your problem-solving hat on all of the time. And so I think we need to think about it at a fundamental level. I think we tend to go to targeted funding when we want something specifically for folks. I think Paragon right now, you know, not taking a position on that just because we don't really have one at the moment, but is also looking at kind of the building blocks. And so how can we reorient some of these building blocks to kind of turn the tap of that funding on a little bit more? So you're only 2% of Medicaid spending right now. Can we use this rural health transformation program to work with the states to come up with other partnerships? You said you have hospital partners. Can you have insurance company partners? Can you have MCO partners? We talked about it before, right-sizing care. Specialty care is not going to be something that is always going to be super obtainable in rural areas. There's a lot of research that talks about how even when specialty care is available in rural areas, that folks tend to travel. And I think that they'll travel to the urban areas. And I think that gets to what I was talking about before, like this sense of trust. And I think trust across the board for patients ends up going to like where they think the most money is. So, when a patient is diagnosed with cancer, they think of MD Anderson and they think of the Mayo Clinic as like where they want to go for care. That also might not be where the best doctors are. There might be a really awesome doctor at the rural health center or at any of these other places that can treat them. But because we've tied funding and resources to kind of who should be trusted the most, that starts to erode where patients want to go. And I think, as changing patient behavior is the hardest thing that you can ever do. It's the hardest thing to legislate. It's the hardest thing to have funding on. But we need to start thinking about that too. Where our resources go are also a signal of who we're trusting the most. And the data says that we should be trusting health centers. The data says that we should be trusting people that are meeting them in their care. And so I think when we think about rural areas, indigent communities, it's also portable healthcare, whether that be, mobile clinics, but portable health insurance, HSAs, all of these. So we can think about how can we get it to where people can use their HSA funds at health centers? How can we get it to where we can have more mobile clinics, and all of these different things? And so that's reorienting the building blocks. I think that there is a conversation to be had about targeted funding. I'm excited that you guys were a part of the Rural Health Transformation Program. I was really worried that you weren't going to be and that it was going to end up being the Rural Hospital Fund. And I think that it's really important that that H in RHTP stands for health, not for hospital. But I would say that on the Hill right now, there's definitely a movement. There's a growing sense of we're spending all this money on hospitals and insurance companies are not getting anything for it. Where can we get that money? And folks are turning to health centers for that. So I think that there's a lot of momentum. And we talked about it before. Don't let the fear get in the way of that momentum and go and have those conversations. I think that conservatives are really looking for things to be for in healthcare. I think traditionally we end up being against things, the repeal and replace effort, all of that's it. But there's a lot to be for, and health centers are one of those things. And so I think that's the momentum that you have to go and say is, come and show up and be here for us, and then we can see what that turns into.
Well, one thing I'm just going to plant a seed on is if there is an interest within Paragon to look at what a targeted fund for health centers would look like, we would love to talk with you about it. That goes without saying. But also just to continue to engage in these conversations, since I think they're so rich and so important. One of the other things that I want to lean into a little bit is just innovation. I also think right now there is so much interest and desire to see innovation in the healthcare space as a whole. I think health centers, sometimes by necessity, are incredible innovators because they are literally designed to meet the needs of their community. They have the consumer majority board, and so they're looking at, okay, again, going back to sometimes it's medical, but sometimes it's the surrounding challenges or needs of the community that they're then able to sort of innovate to respond to those needs. But I am curious just what you're thinking in terms of what does that look like across the healthcare system? Like what kind of innovations would you like to see or lean into? And then I think connecting it back to health centers, like are there things that you see health centers playing a role in specifically in that space? Yeah,
I'm really excited about AI, and not under the traditional context where I think we're gonna have AI doctors and it's just gonna replace that, but just some of the efficiencies that come with AI, and I think especially on the research end. And so you'll actually hear current NIH director Jay Bhattacharya talk about this, but replication. I think we make a lot of policy decisions based off of certain research that can't actually be reproduced. And the more that we can just reproduce things and keep going forward, the better we're going to have more data-informed decision-making. And so I think AI can be really, really helpful there. I think AI can also be helpful in terms of modernizing the way that we do things, looking at patient data, especially when we're talking about changing patient behavior, especially, substance abuse, addiction services, all of that there. I think other innovations in healthcare, I think for too long that we've talked about telehealth as almost being like Zoom medicine. Like you're at home and you like log on to Zoom and you see a provider. But I'm really excited about as we kind of get away from telehealth being Zoom medicine and get more into like these technological innovations about how can you start to supplement specialty care. So I think that that's, something that could be really exciting for health centers is if a provider at a health center is able to sit down with a patient and teleconference into a specialist that exists in an urban area, that's offering care without that patient having to travel. I talk about this in addiction services a lot, like try and get an addict to get in the car to drive an hour and a half to go into this urban system or somewhere else where they have more resources. So we need to really get back at that. I think, innovations overall, I'm really excited about like personalized medicine. And personalized treatment plans, and that gets at what we've been talking about here. Like patients are not a monolith, their communities are not a monolith. We standardize care to somewhat be a monolith, but how can we move forward in that? So I think personalized medicine is really, really exciting. I'm really excited about direct primary care, just these different concierge models. I think that a concierge model is kind of something that a health center has been doing for a while and just haven't been calling it that. I think now it's like the more modern term, right? But that's very exciting. I think that there's just like a lot of innovation to be had in the health system. I think for me, that's also taking a look at the way that we subsidize and even cross-subsidize things. You brought up 340B. We talked about DISH a little bit. How can we use healthcare innovation to like truly make these programs better and serve the patients that they're supposed to? 340B is supposed to be about stretching resources to help patients, and it's really turned into windfalls for other folks. But I think anything that we can do to get the patient more involved, to make things be less onerous, that's where we need to go in innovation, and that's what's going to be most important to health centers is finding things to be able to have better cost containment, but do things quicker and do things better. And I hope that we can start to see some of those costs go down. And I think that has to be married with efforts in deregulation and desubsidization. So then hopefully we can have more money that's targeted at the patient. But I'm really excited right now with MAHA and personalized medicine and all of these other innovations that we're putting patients in the driver's seat. And anything that we can do to just make healthcare more approachable for the patient is going to be critical.
Well, I think it's interesting, and I appreciate you bringing up that, health centers are only 2% of the spend in Medicaid, in spite of how much we're actually, the number of patients and what we're bringing to the system. It's similar in 340B, just in terms of we're 5% of the overall total of the program, and again, these are not small numbers, but to your point about 340B, I do just want to plug that it's like, the intention of that program was to bring in dollars that would stretch federal resources to be able to make sure there was access and good care available to people who need it. And that's literally what health centers are doing over and over again. So it's interesting because I look at it and I say, okay, well, what if we just doubled the percentage? Like, it doesn't have to be crazy. It could go from 2% of the spend in Medicaid to 4% or 5% of 340B to 10%. And the difference that would make for health centers and, more importantly, patients
and patient satisfaction.
Yes.
I think too often we think of patient satisfaction of like quite literally like when you are leaving the doctor, like how do you feel? And that also gets to something overall in our health system that we do. We're really focused on episodes of care. So like from the minute that you step into a clinician to when you leave, so that be a 4-day hospital stay or that be the entirety of the time that you had the flu, we're really focused on things being episode based. And that's where health centers like just completely flip that on its head. It's not just about an episode of care. It's how can we prevent an additional episode of care? How can we shorten the length of this episode? I'll never forget someone in March was talking about, how you guys give out socks. And I had never thought about, the difference that could make for an indigent patient that was, maybe even homeless, and kind of how that helps with medication adherence, how that helps with, not needing wound care later on. And those are things that I don't think that we're thinking about because we're so focused on episodes of care.
Yep, I totally agree. And to your point, you've said it multiple times. There are so many things that health centers do where they do not get reimbursed. They just figure it out. But we really, I'm excited about the opportunity to hopefully change that going forward. I'm looking at the time. We're pretty much out of time at this point. But I want to just end with one thing, which I think would be so wonderful to hear. And that's what's your biggest hope for the role of health centers and that they can play in the future of healthcare?
I think my biggest hope is that folks know when you can go to them and that they just like in general become more popular and at the center of these conversations. I think stakeholders that are in this space need to start listening to health centers a little bit more. And like we said, when we talk about those building blocks, really starting to reorient those building blocks towards health centers. I think that they are the future. They're the future of the MAHA movement. I think they're the future of taking care of folks that are more indigent and underserved. And I think that they do it in a creative way. And so I'm most excited for the future just to see how much more creative you can get and how you can kind of keep pushing the envelope and pushing the surface on making us really think about our health. I feel like I've learned so much since I've started to, really go under the hood and take a look at this a little bit more. And I'm excited for kind of the momentum that you guys are having in the policy space. I think you have a huge opportunity with MAHA. I think you have a huge opportunity with this rural health transformation program. And I think that you're starting to get more champions. And so I'm most excited to see your champions grow and for us to have greater conversations even beyond targeted funding, but taking a look at really taking the data that's coming out of the really great work that you do and operationalizing that into making changes overall in our healthcare system.
I love it. Thank you. And I can't wait for the next conversation. Elle. Thank you so much for joining us. I hope you enjoyed the conversation as much as I do. Elle, you are welcome back anytime. We appreciate the work that you're doing and just the opportunity to have the conversation. And I hope it resonated for folks that were able to join us today. We look forward to seeing you on the next episode of Community Health Centers Unfiltered. Thanks, everybody.